So how exactly is the heart affected by cancer treatments?
Well, the heart can be affected in many, many ways, but probably the most important take-home message, if you want, is the potential toxicities to the heart from cancer treatments called cardiotoxicity. And there are many cancers that receive potentially cardiotoxic medications. Now, let me start by saying that, of course, these medications are strictly necessary. And cancer therapy has made tremendous leaps and bounds in terms of cure rates. But we have to keep an eye on some of the side effects of these medications. Again, I don't want to overscare the audience about shying away from cancer treatment. On the contrary, if anything, my mission as a cardio-oncologist is to minimize the time where a cancer therapy could be withheld. If anything, I want to continue cancer therapy as much as possible and minimize that period where we have to hold the medication or the radiation to the absolute minimum.
Absolutely. Now, we have a graphic, and I want to know, Doctor, which of these most affects the heart? We have a list of several of them. Let's start with chemotherapy, which is, I think, the most popular.
Yeah, well, chemotherapy would be probably the number one, again, take-home message in terms of what to be aware of when you receive cancer therapy. Chemotherapy can affect the heart, potentially, depending on what the chemotherapy is. Let me start by telling you that not all chemotherapies affect the heart. Okay. There's only very few of them. And even those, the percentage of affection to the heart, or where the heart can be affected negatively, is minimal, very, very small number. But we have to be aware of them. If anything, probably the most important cancer we want to concentrate in terms of chemotherapy is breast cancer. Breast cancer is a type of cancer that's very dear to the population in terms of it can affect, mostly women, and 95% of the time. Men can get it too, but it's mostly women. And it affects basically all ages. It can affect all, there's no, besides genetics, there's no other risk factor for breast cancer.